Welcome to The Current by TreasureCoast.com, where we discuss interesting people, places, and happenings on Florida's Treasure Coast.
Maybe we can start with just an introduction of who you are, what your specialty is, and who you typically serve.
Sure. So thank you for having me today. A pleasure to be here. So my name is Marc Silver. I'm an orthopedic surgeon. I work for the Cleveland Clinic up here in Martin County. I have a subspecialty in sports medicine, which means that after my orthopedic training, I did an extra training dealing with sports medicine. Sports medicine, we treat active individuals across all age groups, from adolescents to older people. And our goal is to try to keep these active patients active, get them back to their sports, their activities that they enjoy, soon as possible, either with surgical or non-surgical options.
That sounds great. What to kind of start it off, what are some injuries that you typically deal with? What do you see locally most often? And I guess that'll probably differ between someone who's an adolescent, maybe it's like a young person who's in sports versus an older person who maybe is just trying to stay active, right? Or maybe I'm wrong in that regard.
Correct. Yes. So, in the adolescents, we usually see, football injuries, basketball injuries. As we move into an older population, we'll see patients, pickleball players, tennis players, joggers, and the injuries run across all different joints depending on the sport that they play. So we can see shoulder injuries, rotator cuff injuries, dislocated joints, tear in ligaments or tendons in the knee and the ankle, hip injuries. And like I said, we evaluate them here in the office. We'll get some imaging if need be. And then with the Cleveland Clinic, we can refer them either to physical therapy. We have MRIs available, and then the appropriate other specialists if we need to get other doctors involved or other healthcare workers.
And that's probably a good segue to the next question. When you talk about maybe other specialists who become involved, what would you say is the reason people struggle to get back to being active? Is it maybe rushing into it, maybe not seeing care as early as they should have? What usually delays someone when they get an injury?
So the delay could be for a number of reasons. I think the most common one that I see is people just want to give it time, understandable, to see if it'll get better on its own. And then sometimes it just doesn't get better. The symptoms continue, they get worse, and they have difficulty returning to their level of activity or sport that they want to do.
What role would you say something like physical therapy plays in recovery? I mean, is that something that people usually, they'll come to see you first and that referral will kind of take place as needed, or how does someone use that from a recovery standpoint? So
patients, they'll usually come and see us first for their specific injury. We'll examine them, evaluate them, like I said, get some kind of usually imaging study. Once we have a diagnosis, depending on the specific injury and on the person, we'll either treat them non-operatively first, which involves a lot of times a referral to physical therapy to work on rehabbing that joint that was injured or that muscle that was injured. And then other times they require surgical intervention, which also most of the time requires physical therapy post-surgery to try to get them also rehabbed back to the level where they were beforehand. So physical therapy plays a vital role in treatment of these kind of this type of patient population.
Yeah, I can see that. And I guess it would be interesting to know from your standpoint, things like movement, when someone's experiencing pain, how does when should someone see, an orthopedic, let's say someone like you, and maybe you can touch on maybe the difference between sports medicine or your specialty in kind of a traditional orthopedic care that someone's used to, when should someone see someone like you? I mean, I think most people, oh, geez, you got a stinger in your shoulder or your knees, or, you probably try to tough through it a little bit, or you ignore that tight hip. When does someone see someone like you, and when does it escalate to maybe having to get a referral and maybe more long-term care?
Sure. So I would say probably two different scenarios. So they should see a doctor like me, or at least have their injury evaluated if it's been going on for a while. So I'll see patients sometimes, they had an old injury from like 5 years ago, maybe had some kind of treatment, never really got back to the level of activities that they wanted. So then they'll usually come to me for a further evaluation and treatment. The other scenarios I usually see is somebody who has more of an acute injury. They twist their knee on a tennis court. They kind of fall playing football. They have increased pain, swelling in the specific joint. They have limited mobility in the joint. Their joint dislocated. They have a shoulder that just doesn't feel stable, dislocates on them. So that's another scenario where I'll see the patient, again, treat them, evaluate them, get some advanced imaging if need be.
Yeah, and I'm sure it takes a lot of nuance in your field. That's one thing that I've always thought about. I've seen orthopedics a couple times for sports-related injuries, and it always has seemed to me like, geez, who knows? Do you let it go, or how if you've got an issue with your knee? I mean, maybe they can take some imaging, they can see what's going on. It's always seemed to me kind of as there's more of a gray area than some fields where maybe, you take a test, you get a swab and hey, this is what you're dealing with and this is what we're doing. Does that make sense, or am I totally off base there?
No, I think it makes a lot of sense. And then fortunately, again, especially in Cleveland Clinic, we have a lot of these, the advanced imaging and the subspecialists that I think we can figure out a lot of these kind of conditions, and then again treat them appropriately for that specific patient.
Yeah, having that technology, I think, is critical. And I'm interested to know from your standpoint, getting back to kind of the adolescence and the maybe if someone's they've got someone in high school, they're on the basketball team or the football team, or just in general. What advice would you give to families or young people who want to prevent sports injuries, or, even if they get an injury, make it not be a long-term thing? Because that's something that resonated with me when you had mentioned sometimes people have something that lasted for a while. I think there's plenty of people who might listen or watch this who they kind of know what that's like. They had some knee thing that they could tough through it when they were in their teens or early 20s, and then it kind of catches up to them. So I'm interested what your advice would be to those families or young people.
Yeah, so injury prevention is obviously very important. I mean, as much as we like to take care of patients, we want to see them not have to come to the hospital or to the doctor and enjoy their sport. So usually we'll recommend stretching, warm-ups before any type of sport or activities. If you have a minor injury, you want to kind of gradually return to that sport or activity and not just kind of rush back. You want to wear the proper equipment. So you mentioned, football players and adolescents. You want to wear the protective equipment. If you're riding e-bikes, which I see a lot of adolescents do, you want to wear helmets. Yeah. You want to rest when you're tired. A lot of the injuries I see is the typical scenarios. Well, I was doing my last lap or my last activity, and at the end of the day. So when you're tired, right, I would say either take a break or just stop. In Florida, especially, you want to stay hydrated if you're doing any kind of outdoor activity. And like anything else, you don't want to overdo it. Overuse injuries are also very common. I'll see a lot of those, especially, again, talking about adolescents. When they come back for the school year, they've been resting during the summer. They start doing their 3 different sports, then they play with their friends on the weekend. a lot of overuse injuries, stress injuries to the joints. So I would probably say just kind of try not to overdo it, especially at the beginning.
Well, there you go. I'm gonna remember that. I'll tell my wife that next time I'm relaxing on the couch and let her know it's time to. I don't want any stress fractures going on. That's
There you go.
yeah, right. That's interesting. You had mentioned the e-bikes. Have you seen a lot of the e-bike riders coming in? Because I see them, and it's honestly like anxiety producing sometimes when you see these kids on these e-bikes.
Yeah, fortunately, I haven't seen a lot recently, but I'll see some of these kids popping wheelies, sitting on their bike with like three different friends,
Right.
and falling off those bicycles. I mean, again, you can hit your head, you can, injure or break a bone, and especially in lower or upper extremity. So you have to be cautious, I guess, with any type of activity involving any motorized sport.
Yeah. Yeah. That makes sense. I'm interested. Would you say that there's an injury that people commonly ignore? Maybe something that they people have an injury, they have this nagging thing, and it usually turns into a problem later. Do you see any sort of pattern in any sort of specific injuries?
Yes, so you do see that occasionally, and I'm thinking of certain scenarios. I'll see a patient who had an old injury a couple of years ago, playing some kind of sport, twisting their knee, and the knee initially swelled on them, was painful, and then it gets better. They never had it checked out. But their problem is when they do certain types of activities, their knee gives out on them. It feels unstable. So sometimes you can have an ACL, anterior cruciate ligament injury, which is common in certain types of sports. And if it's not treated appropriately or sometimes surgically repaired, it can lead to a problem where the knee gives out on you, causes further damage. Other scenarios I see where patient had, let's say in the past, they had a dislocated shoulder. And they, again, once the shoulder was kind of put back in place, never really treated it appropriately. And then when they do certain activities, the shoulder feels unstable or sometimes will actually dislocate on them again. And I'll see some patients who have multiple dislocations, and obviously you don't want to have that happen. And those patients, if they're certain types of injuries we'll see on their advanced imaging, will actually take them to surgery to stabilize the shoulder, prevent those kind of scenarios from happening.
Yeah, that makes a lot of sense. And I was going to also ask you, and maybe this is kind of a redundant question, but I think you may have answered it. I was going to ask, what are some signs that some of these injuries are more serious than people realize? And I imagine that it goes back to that. Like if it's like you had mentioned before, if it's lasting for a long time, or if you're experiencing it for a while, or if you feel maybe that instability, does that sound right? Or what are some different things that you might mention to someone to say, hey, look, this is probably more serious than just sitting on the couch and resting for a day or two?
Yes. So, kind of what to lead into what you answered. So, if you have, let's say, again, I'm talking in an acute injury here.
Right.
If you have pain, increasing pain that's just not getting any better in a short period of time, swelling of the extremity or of the joint, limited mobility, difficulty getting around, pain when you put weight on your leg or move your arm in a certain position. If you have numbness that's just not getting better, those are kind of more concerning signs to me. If you have what you think is a minor strain or sprain and you rest it, put some ice on it, you take some over-the-counter anti-inflammatories, if you're not really seeing much improvement in a few days, then also it's another reason to get it evaluated and checked out.
Yeah, that's good to know. It's I'm realizing now so many different situations where I'm going like, I probably should have seen a specialist for this or that, or something or the other. I'm interested to know, like, I know we had talked about physical therapy. We had talked about referrals for specialists. But I would like to talk more about recovery, the recovery process, not just, what other specialists might be involved, but how someone can safely return to activity and what that process looks like.
So when I see somebody, whether they were treated non-operatively, conservatively, or surgically, usually I'll start sending them back to activities and their sports that, well, depends on their injury, but in general, you want to see, minimal pain, if any. You want to see that they have full motion of that joint that was injured or that extremity that was injured. Their strength is up to speed. Their endurance is up to speed. And at that point, you'll gradually let the patient start going back to their level of activities. So let's say if they're tennis players or pickleball players, not that I'll have them play 3 hours of one-on-one tennis the next day, but you want to have them gradually go back, getting their swing back, getting their motion back on how they swing the racket, have them play for a gradual small amount of time and then build up their level of activities as they continue to improve. And there's been no increasing pain or diminished response when they're playing.
Yeah, and I'm sure that would be, especially the more competitive someone is, the harder it is to kind of slowly get back into it, get that movement back. Do you recommend to patients as they're getting back into things any daily habits that they can do to maybe stay mobile, or is it kind of, are you focused mostly on the treatment and recovery of that during that window, or do you usually give any specific habits that people can take on to stay mobile and maybe to reduce their risk of injury down the line?
So in general, you want to have the patients, like I said, do some warm-ups, not overdo their specific sport, especially if they're coming off an injury. Again, in Florida, you want to stay hydrated here. You don't want to have any issues out in the hot Florida sun, especially in the summertime. And again, depending on the specific injury, some injuries after surgery take about almost a year until they fully recover. So I'm talking about somebody who kind of tears up their knee, has multiple ligament reconstruction. It can be about 9 to 12 months till they're back playing at the pre-injury level, their sport. But in general, like I said, we try to get them back to their level of activity, either with operative or non-operative treatment.
Well, what are your thoughts on specific sports that might lead to someone being more injury prone? I mean, I know for some people at a younger age, maybe kids are less attuned to play football, or maybe more kids today are playing golf than I was younger. Adults, obviously, more adults are playing pickleball than ever before. Are there any sports that you see as seeming to be more, it creates someone who might be more injury prone?
Well, I think any sport does carry risk, but the alternative is, you can stay at home and do nothing all day, which is not a good thing either. So I would say down in Martin County, we see pickleball is very popular down here. It's usually a more mature population that plays it. So, you'll see a lot of falls. You'll see upper extremity injuries, anywhere from fractures to torn tendons in their shoulder. I've seen hip fractures from pickleball. And then in the, again, younger population with football or any contact sport for that matter, there's, again, risk of having any kind of major joint ligament injury, fractures. Golf, usually you'll see a lot has to do with kind of, I would say, back injuries because of the forces that you put on your back when you with the golf swing. I've seen injuries where people have fallen out of the golf cart. So whatever you're doing, you just have to be careful.
Yeah, I guess you also have those auxiliary things, golf carts and things that happen outside of just the normal actions that you're taking in the sport itself.
Sure. I mean, one thing I see pretty commonly, it's not so much a sport, but people just walking their dog. I see the dog kind of takes off, pulls them, injures their shoulder, they fall down. So, like I said, stuff happens, unfortunately.
Yep, that's interesting. Yeah, I guess it does make you think how ready are you for any daily task? Because sometimes I was talking to a friend of mine who I had wrestled with in high school, and it's like, you get out of bed and, the old trope, you get out of bed and your back's kind of sore. Or, you're thinking like a lot of these daily injuries or maybe the immobilities that you start to feel, it's not usually because, you're playing some big basketball tournament or, you're usually walking the dog or you're usually going down the stairs and you slip or something. So it is interesting to think about, staying mobile, staying healthy, trying to reduce the risk of injury. So, we don't have to see you unless it's really necessary.
Correct. Yes. I mean, I don't mind seeing anybody, but hopefully people will stay healthy, stay mobile, and stay out of the hospital.
That's great. Well, Dr. Silver, where can patients see you? Where can they learn more about what Cleveland Clinic's doing, especially here locally? And do they have to schedule visits? Can they get walk-in care?
Yes. So at Cleveland Clinic, they can do scheduled visits, but for more, I guess, urgent problems, they can come in as a walk-in, and usually we'll have a specific number for them to call. Number I know is 877-463-2010. This will be posted on the video, and we see in multiple sites. We're down in Cleveland Clinic South, down in Stewart. We're up in Tradition, in Port St. Lucie, and Indian River up in Vero Beach.
That sounds great. Yeah, we'll put the video or the number in the video description as well. So if anybody does need, God forbid, something urgent, they know where to get it.
Well, thank you, Josh.
I appreciate it, Dr. Silver. Thanks so much for being on it, and I appreciate your time again.
Yep. Thank you, Josh. Take care.
That's a wrap for this episode of The Current by TreasureCoast.com. If you enjoyed the conversation, be sure to subscribe so you never miss an episode. You can find us on Spotify, Apple Podcasts, and YouTube. Follow us on social media or visit TreasureCoast.com for local events, tips, and news. Have a guest or topic you'd love to hear on the show? Let us know at TreasureCoast.com. Until next time, keep riding the current and enjoying everything the Treasure Coast has to offer. See you soon.